Hello, my name is Mary Poston and I am the Director of Nursing here at Nashville State Community College. Welcome to our information session regarding the admission process to the nursing program. I'm going to inform you of the requirements, selection criteria, and process for the upcoming application cycle. This application cycle begins January 1st and closes April 1st. All dates and times for question and answer or Q&A sessions will be available at the end of this audio presentation. While it would be great to admit all of you into the nursing program here at Nashville State, please understand that nursing is extremely competitive. There are multiple nursing programs throughout Tennessee to assist you in reaching your goals. This link for nursing education in Tennessee is available for you to review other programs. As a nurse, I recommend to all advisees not to put all of your eggs into one basket. Please look at the other programs and apply to several in order to give yourself options based on your expectations. This website is beneficial for the review of all programs from AAS, like Nashville State, which is a 2-year program in addition to the prerequisites, to a BSN, which is a 4-year program including prerequisites and additional courses, to a master's or a doctoral program, either a DNP or a PhD. In order to apply for the AAS or Associate of Applied Science program, you must be currently enrolled at Nashville State Community College. This does not mean you have to have taken courses here, but you must be admitted as a student. This allows us to view your courses and ensure you have completed all course requirements. The nursing department does not decide transfer coursework. This must be submitted during your application process with Nashville State Community College. The records department will review all transfer courses and either accept or decline necessary coursework based on course descriptions and requirements of all transfer courses. What does this mean? It means, for example, that an English course you took at another school may not meet the objectives and/or outcomes of the Nashville State English department. Therefore, you would need to take that course over again to fulfill the prerequisites of Nashville State. If this could not be accomplished prior to the nursing application cycle, you may not meet criteria for admission. As part of the application cycle, you will also be required to review the audio PowerPoint presentation of the information sessions and attend one Q&A session. On the application, you will be asked which session you attended, and we will be monitoring attendance for verification. You must complete the Nashville State nursing application in its entirety with your Nashville State degree works attached for review. Do not submit your degree works from another institution. This will not be accepted and will cause your application to be rejected. We do not notify students of incorrect information on their applications. This is the responsibility of the student to follow directions in order to submit the correct application. The student must have a grade of a C or better in all prerequisite courses. D's and F's are not accepted and will automatically cause your application to be rejected. If you need to take a course over to improve your grades, you may do so. This will improve your chances of being admitted. Please note that financial aid may not pay for a course to be retaken to improve your grade. You will need to contact your financial aid representative to determine what they will and will not pay for based on your advising handout and the financial aid program you have been accepted into. We are also one of the only nursing schools that takes your highest grade when you retake a course. The majority of schools nationwide only review your full GPA, including all courses and all retakes. GPA is extremely important in nursing. While we do have students who are admitted into the program with a GPA of 2.8, this is not necessarily common. Again, nursing is extremely competitive and most admitted students begin the program with a prerequisite GPA of a 3.5 or greater. You want to do the best you can in every course. It gives you a much better chance to be admitted. All students must take a standardized entrance exam called the ATI-TEAS exam. The information related to this exam is located on our website at www.nscc.edu/nursing on the right side of the screen. You may sign up for any of these dates listed in our testing center, and you may also sign up at any testing center around the area. Please note that due to COVID, we are one of the few testing sites available. So seats are extremely limited due to CDC safety precautions during the pandemic. Do not wait until the last minute to sign up. Instructions are posted for sign up on this link as well. Do so through the Nashville State Testing Center, and you will save almost 50% of the cost to take the exam. You must receive a score of at least proficient in order to be considered for admissions. If you score basic or below, you will have to wait 45 days to schedule the exam again. Again, please do not wait to the last minute to sign up. English as Second Language students, or ESLs, must complete all courses recommended by the Michigan test. No waivers will be allowed. Although we allow students to be in progress in courses required for admission throughout the spring for fall admissions, preference is always given for fall admission to the students who have successfully completed all courses upon submission of the application. The remaining students who meet all criteria but are not ranked in the first 50 for fall admission will be placed on a waiting list. This may include students still in progress with prerequisite coursework in the spring. Those students placed on the waiting list will be given priority for admission into the spring class. The Nashville State Nursing Program requires a total of 27 credit hours in order to apply for admission. This may mean your courses are in progress. However, it is required that coursework be completed prior to admissions into either the fall or the spring class. Math and science courses include microbiology, anatomy and physiology 1 and 2, and introduction to statistics. It is recommended that science courses be taken within 5 years of the admission date. However, it's not required. Taking these courses within 5 years will assist you in being successful in our nursing program due to the content available in all nursing courses. There are 3 general education courses required: English Composition 1, Intro to Psych, and a humanities elective, which is available for review in the catalog. In order to find out which humanities elective is accepted, you may visit www.nscc.edu/catalog and search humanities, or you can go into your degree works and the courses are all listed to fulfill the 3 credit hours required. Finally, there is one additional general education course required of the 27 credit hours. You may take one of the following courses: English Comp 2, Lifespan Development, Fundamentals of Communication, or Principles of Nutrition. Only one of these courses, not all 4, is required. This is what your nursing curriculum will look like if you are admitted to the program. Nursing school is considered full-time. The only semester that a student may be able to work is usually fundamentals, which is the first semester. The first semester is 7 credit hours and includes 1 full day of lecture, which includes a fundamentals lecture, head-to-toe assessment class, and a math course. 1 day of skills, and a full day of clinical. Time-wise, this is different than a normal 7-hour course load. Not only will you have 3 days of the week for courses, you will need to schedule study time around this schedule. The faculty is amazing in helping break down this time for you and help you find your study strengths and learning style. During semester 2, your time commitment and course number increases, and you end up with 3 courses, which equal 10 credit hours. The courses in this semester are MedSurg 1, Mental Health Nursing, and Pharmacology. Again, along with a full day of class, you will have 1 simulation day and 2 clinical days. Semester 3 is the busiest of all the semesters and requires the most commitment of all of our students. Organization, prioritization, and time management is extremely important of all the semesters, particularly the 3rd semester. This semester includes 4 courses equaling 13 credit hours. The courses are MedSurg 2, Pediatrics, Women's Health, and Pharmacology 2. Along with a full day of class, you have an additional evening course, 3 simulation days, and 3 clinical days dispersed throughout the semester. Finally, in semester 4, we finalize your preparation for the NCLEX to take your boards. You have 4 courses which you are going to take throughout this semester, which include MedSurg 3, Leadership and Management, Pharmacology 3, and an NCLEX preparation course to get you ready for your boards. This time is used for you to evaluate your strengths and weaknesses throughout the 4 semesters and immerse yourself in NCLEX-style test questions for preparation for your boards. After all, you can complete all 4 semesters of the program, but you are not a registered nurse until you pass your boards. We have designed this program to prepare you for this eventuality every step of the way. Faculty revisits costs every year to ensure that the Nashville State Nursing Program provides an affordable experience for its students. Items related to cost expenditures throughout the 2 years involves multiple items, including but not limited to uniforms, supplies such as a stethoscope in your skills bag, integrated learning and examination fees, tuition, immunizations, insurance, background and drug screen, books, and there are several other things as well throughout the way. This cost sits at approximately $10,000 for the 2-year program. The entrance exam we require as a prerequisite item for completion of the application process is the ATI TEAS exam. There are 4 sections in this exam similar to an ACT or SAT. Study materials can be purchased through their website or online through Amazon or other vendors. There are sample exams available online as well. Again, these may be purchased separately and are not included in expenditures from the previous slide. Instructions are available on the NSCC nursing website at www.nscc.edu/nursing. Go to the right column of the links and click Nursing Entrance Exam. Test dates are posted from now through March 29th to allow students to receive their scores within 48 hours prior to their application deadline. Please understand that there is extremely limited seating related to COVID, and our testing center is only one of the only testing centers open in the Nashville area, so reserve your testing date early. Due to COVID, we are not having interviews for this academic year. Therefore, the point criteria have been modified to reflect this. A student's application will be reviewed for GPA and performance on the TEAS exam out of a total of 60 points. Those students receiving the highest points out of 60 will be ranked for admission into the fall cohort or class. The remaining students meeting criteria for admission will be placed on a waiting list. Those placed on the waiting list will be given priority for admission into the spring cohort or class. Please utilize this checklist to determine whether you are prepared to apply to the Nashville State Nursing Program. You must have a GPA of greater than 2.8. You must have a minimum of a C in any college coursework. You must be admitted to Nashville State with all official transcripts sent to the admissions office. You must present a completed Nashville State nursing application and have all prerequisites completed by the assigned semester depending on whether you are applying for the fall or the spring cohorts. You must attend one Q&A session through the year that you're applying. Send completed application to the Nashville State Nursing Department W35. That is the Weld building, and the office is W35. Prerequisites for the LPN to RN Bridge program are identical to the traditional AAS program. You must be a student in Nashville State and be admitted, receive at least a proficient on the ATI TEAS exam, have a GPA greater than 2.8, have a C or greater in all required prerequisite courses, and have completed 27 credit hours of prerequisites. Where the Bridge program differs is that you must also have the following: a PN license number, at least 1 year of verified employment history, a professional reference letter, and a completed application including all of these additional items. Upon acceptance to the Bridge program, you will receive an orientation explaining the additional items required to successfully earn 7 prior learning assessments, or PLAs, for Nursing 1710, which is the fundamentals course. Do not do these items prior to being accepted. It will be a waste of money if you do not get accepted. The 4 items include a Kaplan PN transition exam, a full head-to-toe assessment. You must successfully complete 2 out of 5 nursing care plans with a grade of 77% or greater, and you must pass a dosage calculation exam with a 90%. Should you successfully complete all 4 of these items, you will receive 7 credit hours of PLAs for Nursing 1710 and will earn a spot in the second semester beginning in the fall. If you're unsuccessful in completion of these items, you will be offered admission into the traditional AAS program for the full 2 years. All completed applications will be accepted beginning January 1 to April 1. If you are allowed access to campus during this time, please place the completed application in the drop box outside of W35, which is the Healthcare Professions Division's office. Again, that's in the Weld Building, W35. The fall class is limited to 50 students and the spring class is limited to a class size of 25. Thank you very much for attending this audio PowerPoint presentation of an information session where we have discussed admission and selection criteria for the nursing program. Please choose a date and time available on the website to attend one of the following Q&A sessions available through March. If you have any questions beyond what has been explained here, there will be a couple of members of the nursing department available to answer your questions on these dates. I will be one of them. So if you have anything for the nursing program or the nursing department, in addition to what you've heard today, please feel free to attend and ask any questions that you may have. Thank you.